Refractive eye surgery is a very broad term that's utilized in the eye care industry, and it simply means that it is a technique, whatever technique that is, that addresses the surgical correction of an underlying what we call refractive error. And refractive errors can consist of nearsightedness or myopia, presbyopia, which is the loss of near vision as you get older, hyperopia or farsightedness, or some of these new terms that we employ as technology has advanced, and what we generally refer to as higher order visual distortions. Now, here it seems LASIK, I think we're able to benefit the patient because we employ multiple strategies to take care of the underlying refractive problems that a patient may have. So when we're employing the term refractive eye surgery, we have multiple entities within that term that we utilize to best address the patient's problem that they may have. All of us are familiar with what we call LASIK, which is a corneal-based procedure that we use a laser to modify the shape of the cornea to take care of whatever underlying refractive surgical problem that we're trying to address. But once again, LASIK is just one of many types of surgical refractive procedures that we can employ. The more historical approach that we used was what was called PRK, and that was before the advent of LASIK. And PRK simply means that we scrape the surface cells off the eye and then do the laser on the surface of the eye instead of creating a flap like we do with LASIK. There are a number of reasons why we would do it this way, but one of the primary reasons probably is a thin cornea. If a person has a thin cornea in relation to the prescription that we have, we can conserve a great deal of tissue by employing PRK over the LASIK procedure. Other refractive surgical techniques could include INTACs, implantable contact lenses, and also one of the ones that are frequently employed would be the extraction of your lens. So in a way that we typically would take out a lens if it had a cataract, we can do the same procedure from a refractive surgical standpoint. We can take your natural lens outside the eye and replace it with an artificial lens that takes care of the underlying problem that you have from a refractive standpoint. So if you are, let's say, 50 years old and you're very nearsighted or you're very farsighted, it may indeed be to your benefit to do a procedure such as what we call a refractive lens exchange instead of employing a procedure such as LASIK. The benefits of that would include, one, you don't ever develop a cataract again. Two is that the quality of vision, especially with these higher prescriptions in the older age group, is probably superior. But we can also offer new technologies such as a multifocal lens that allows you to see the distance as well as close-up, in contrast to if we were to do a LASIK procedure where we were to do what we call monovision, where we try to capture distance in one eye, near vision in the other eye. With a refractive lens exchange, we can place inside the eye a lens such as a restore lens that allows you to see distance and close-up out of each eye. And some people obviously find that to their benefit. So when we're using the term refractive eye surgery, it's important to realize there are multiple technologies or surgical pathways under that umbrella term. We here at the Seams Eye Center are specifically trained to identify which of those pathways would be best for you in your prescription that you have.